imagine our stomach kan. Kalau you tengok cerita pernah tengok tak cerita Alien? Cerita Alien. Pernah tengok tak cerita Alien? Sigourney Weaver. Of course dia ada banyak dia punya. Alien ni dah lama, zaman you all belum lahir lagi dah keluar Alien 1, Alien 2, Alien 3. Lepas tu yang baru ni ada apa tu? Yang ada yang baru punya version. Lepas tu ada yang kat Netflix, korang tak pernah tengok Mungkin korang tak pernah tengok kot, tapi dia ada banyak scene bila alien tu kena cedera, keluar darah dia. Darah atau cecair badan dia bila kena besi dia akan cairkan besi, lepas tu turun ke tingkat bawah, turun tingkat bawah. Pernah tengok tak macam ni?
Pernah.
Okay. Ada yang pernah, ada tak pernah. So because the blood of the alien is an extremely corrosive agent. Kan asid yang sangat kuat, dia boleh cairkan metal, cairkan besi dan sebagainya lah. Kan? So kita pun macam tu juga ada sikit. What do you think? Apa yang saya try samakan? Our gastric acid kan. It's a very corrosive environment dalam stomach kita kan. Dalam perut kita ada hydrochloric acid, pH dia almost 1 kan. So kenapa kita tak terkeluar macam tu? Cair sampai tingkat bawah ni, kenapa tak terkeluar macam tu? Tak cair perut kita?
Ada lain kosa lain.
Because we have protective factors kan. We have corrosive factors in our stomach juices. Dah lah ada acid hydrochloric, very corrosive, very low pH kan. But we also have protein digesting enzymes, pepsin, yang boleh hakis daging. Tahu tak? Kalau kita dah ada daging liat, kalau kita sembelih kerbau ke apa ke daging dia liat, kita boleh letak enzim nak lembutkan daging. Kita letak pepsin dan sebagainya kan. Tapi benda tu ada juga dalam perut kita. Okey, kenapa perut kita tak jadi tembus kan? Tak tercair. Because we also at the same time we have protective factors. So we have protective factors such as gastric mucosa, and we have mucus to defend daripada pertahankan our gastric mucosa daripada the acid and the digestive enzymes. Okay, so these are all in a beautiful balance lah. Dia dalam satu beautiful balance di mana kita boleh macam you all ni sedia kala dalam keadaan yang tenang dan sejahtera, tak ada masalah asid terkeluar daripada perut jatuh ke lantai dan menghakis lantai, tak ada masalah tu kan. Kita hidup dalam keadaan sejahtera. Tapi whenever the balance is upset, so bila you sikit je upset, for example kita punya protective factors tu lemah je sedikit, it can then cause damage to our gastric mucosa. Bila damage to the gastric mucosa, what do you think will happen?
Erosion, ulcer.
So inilah bila this is what is going to happen when there is an imbalance. Maknanya you have excessive corrosive factors, asid terlalu banyak, atau you have a problem with your protective factors you tak cukup bagus. So this will happen kan. Maknanya our gastric contents will start to damage the gastric mucosa. Kalau it can go into the submucosa, which is the part of the layers of the lining of the stomach. In the worst case scenario, it can perforate. Tahu tak maksud perforate? Apa maksud perforate?
Menembus, pecah.
Okay, perforate maknanya dia melubangkan. Perforation is a lubang kan. Perforate, dia boleh perforate sampai tembus. Kalau dia dah tembus sampai muscle ni, then the patient is at very high danger kan. Because a perforation, like I was saying before, a perforated gastric ulcer is not a condition where you can easily survive. It's not suitable for life. Jadi yang saya cakap, you all tengah sejahtera sekarang ni, takkan jadi sejahtera kalau ada perforated gastric ulcer, sebab you akan jadi sejahtera yang tempoh yang selama-lamanya sehinggalah dibangunkan. Faham tak maksud dia sejahtera? Maksudnya sejahtera yang sudah dibalut dalam kain kafan. Itu baru sejahtera. Kalau ada perforated gastric ulcer yang tak treated, dia tak treated. So that's why we don't want it to become this stage lah. We don't want to become this stage, which is an ulcer. Ya. What are the risk factors tadi? Risk factors ni dia. Ni dia. Smoking, genetic factors, stress, infection with Helicobacter pylori. Okay, dah buat tak ni microbiology? Oh, belum lagi? Okay, kita ni advance lah. Okay, so these are major risk factors with peptic ulcer disease. Okay, tapi there's two, the biggest two risk factors are these two. Helicobacter pylori infection, number one, and number two are NSAIDs. These two are the most major risk factors for the development of peptic ulcer disease. Okay, and I'll tell you very interesting stories after this. Tunggu gambar je. Okay, so nampak ni, kalau perforated, peptic ulcer disease, dia boleh menyebabkan upper GI bleed. Okay, upper GI bleed, perforation and obstruction. Yeah. So very devastating and serious complications lah. Okay, so that's why we want to prevent. Kita tak nak, kalau boleh kita tak sampai complication. Kita kena cegah dan cegah. So how do we cegah? With treatment lah, with medical management. Okay, nampak ni dah ada gambar kecil sangat pula gambar ni. This is actually blood in the stomach. Blood in the stomach. And then when there is upper GI bleed, it's very dramatic clinical situation lah. Kalau you all akan attend nanti, bila you all pergi clinical posting, hopefully you boleh tengok lah keadaan di mana patient upper GI bleed. So you kena manage really urgently kalau patient with upper GI bleed. Muntah darah is very dramatic. Muntah darah. Lepas tu bila the blood goes down, kalau goes up, is a frank hematemesis kita panggil. Hematemesis. Pernah dengar tak hematemesis?
Pernah.
Hematemesis is vomiting up. Dia bukan hemoptysis. Hemoptysis is coughing up blood. Hematemesis is vomiting out frank blood, darah merah, muntah. Tapi at the same time, kalau ada hematemesis, there's also blood that will travel down. Bila travel down, dia akan go and dia akan digested in our GI tract. Bila keluar kat bawah kat the rectum, it will be processed blood. It's called melena. Pernah dengar tak melena? It's black tarry stools, and it's very characteristic. Kalau korang jumpa melena, you should have alarm bells ringing. Patient ni kenapa ada melena ni? This is urgent. Kita kena manage the patient urgently because patient is having a GI bleed. Patient ada melena. These black tarry stools. So these are all very serious complications. Yeah? Okay. So let me tell you a story about the two biggest risk factors. Yeah? Two biggest risk factors of peptic ulcer disease. And this is very interesting story because this is I actually I visited the university. Okay, the person, there's one person, one doctor, he actually discovered Helicobacter pylori, and for a long time, for years and years, nama doktor ni Dr. Barry Marshall. He's an Australian. He's living in Perth, Australia. He was working at the University of Western Australia, di mana saya pernah melawat dia. Saya pernah melawat University of Western Australia sajalah sebagai pelawat je. He worked there and dia macam ada jumpa bacteria living in the stomach, and he was ridiculed for a long time sebab macam saya cakap tadi lah, dalam kita punya stomach is a very hostile environment. pH very low, ada banyak digestive enzymes. Ada apa-apa tak you rasa boleh hidup dalam tu? Ada bakteria tak boleh hidup dalam pH of 1?
Ada.
Rasanya masa dulu orang semua kata tak ada. Mana ada benda boleh survive dalam ni? kenapa you kata ada bakteria pula boleh juga ni? Tapi he persevered and he proved that there was a bacteria called Helicobacter pylori that is living in the gastrointestine, no, in the abdomen, in the stomach. It is actually living in the stomach environment, and it is actually the positive factor for a huge amount of peptic ulcer. Kalau ada Helicobacter pylori tu, most likely dia akan ada juga ulcer. Sebab it's a very active agent, dia akan disrupt the defenses of the gastric mucosa. So eventually he managed to prove that this bacteria is living in the stomach. It's also causing a lot of this peptic ulcer, and by eradicating Helicobacter pylori, you can then prevent the formation of peptic ulcer in a majority of patients in the whole world. So bila dia discovered this and he proved this, his discovery changed the management for peptic ulcer disease in the whole wide world. And by this, he was actually awarded the Nobel Prize. So, nampak tak story ni? Just by discovering a positive factor which a lot of people tak percaya in the beginning, he actually changed the management. He prevented the development of peptic ulcer disease in probably millions of people. He helped solve this problem, and of course he was awarded the Nobel Prize. So it's very interesting if you see there is a huge drop. Mungkin tak berapa nampak lah graf ni, graf kecil. Tapi kalau tengok daripada 1999 menurun the prevalence of peptic ulcer disease in the decades after the discovery of Helicobacter pylori. Nanti korang buat microbiology, korang akan belajar lagi more about what the characteristics of Helicobacter pylori. Okay, but this discovery is a momentous discovery where it helped to change the management of peptic ulcer for millions of people lah. Dapat mengurangkan for millions of people. Okay, but there is then in the same decades there's also another risk factor that came about in the past few decades, where peptic ulcer disease dia menurun pada asalnya, tapi lepas tu dia plateau dan dia kekal, maknanya sentiasa ada dalam community. Prevalence is always there in the community even if you eradicate Helicobacter pylori. Why? Because of NSAIDs. Okay, because of NSAIDs. What do you know about NSAIDs? Have you done the NSAIDs topic? Okay, what do you know about NSAIDs? Why is a lot of people taking NSAIDs?
Anti-inflammatory agent.
Huh? Reduce what?
Inflammation.
Huh?
Reduce pain.
Reduce pain. More than that.
Inflammation.
What is the classic NSAID? What is the classic NSAID?
Anti-inflammation.
Aspirin. Why are a lot of people taking aspirin since decades ago? Not for fever. Kan aspirin memang kita boleh bagi for fever, not in children of course, only in adults. Kita boleh bagi aspirin for what else? Apa dia?
Pain.
Boleh kita, okay, definitely fever, definitely as an analgesic, true, kita bagi aspirin as an analgesic. What else kita bagi aspirin for?
Anti-inflammation. Anti-inflammation.
Anti-inflammation, that's related to the pain and fever tadi. There's one key indication that we give aspirin. What is it for? What is it for? Antiplatelet. Why? Stop not bleeding. Aspirin we give very frequently in the past few decades as an anti-platelet agent. For who?
Coronary heart disease.
Yes, for people with ischemic heart disease at risk of having blood clot at the heart, blood clot at the brain. Remember I was telling you during the cardiovascular topic, what are the two things that cause the most morbidity and mortality in this current population in our modern era?
Coronary heart disease.
It's coronary heart disease and
Stroke.
cerebrovascular disease. Betul tak? Heart attack and stroke. So how do you prevent that from occurring? One of the main prevention measures,
Aspirin.
we give aspirin as an antiplatelet agent. Okay, so a lot of people are on aspirin because a lot of people are having ischemic heart disease and risk of stroke. So kita bagi aspirin as a primary prevention to reduce the risk of them having thromboembolic event, because antiplatelet, it prevents the formation of blood clot. Kan? So bila kita prevent formation blood clot, kita reduce the risk of getting a thrombus in the coronary arteries and also in the cerebral arteries. Now, what are the most common adverse effects related to aspirin?
Peptic ulcer.
GI bleed caused by yes.
COX-1 inhibition.
Remember your cyclooxygenase pathway? Tak. Kata je yes kan? Yes. Kan? Tapi tak. When did you do your cyclooxygenase pathway?
Year 1.
Year 1 in your what subject? Biochem. Masa tu mungkin korang tak percaya kan? Tapi it is of crucial importance. The cyclooxygenase pathway is of crucial life and death. Memang betul masa year 1 korang mungkin tak percaya benda ni penting. Korang kata apalah aplikasi benda ni, aku nak jadi doktor, kenapalah kena tahu pasal cyclooxygenase pathway ni. But in fact it is of crucial importance, and this is the cyclooxygenase pathway because it is a life and death situation. Yeah, you must know that it's a life and death situation because of how many people die related to the effect of NSAIDs on the cyclooxygenase pathway. Aspirin as an antiplatelet agent, what is it? What does it do to the cyclooxygenase pathway? Inhibits what? It inhibits both COX-1 and COX-2. So by inhibiting COX-2, it also inhibits the platelet pathway, betul tak? By inhibiting COX-2, it also inhibits all the inflammation platelet pathway semua lah. Tapi it also inhibits COX-1, which is essential for prostaglandin synthesis. So prostaglandins are required as a protective factor in the stomach. So when you give a patient aspirin, up to 10% atau malah belas% of them will have gastrointestinal side effects, and they will be at higher risk of developing peptic ulcers because you have interfered with their protective factors in the stomach. And malah, they will also be at much higher risk of having an upper GI bleed, and some will even die because of having upper GI bleed sebab you dah interfere with the patient's COX pathway with your drug that you give to them to prevent them from having thromboembolic disease. Nampak tak? Nampak tak how important it is to understand what is going on. So that's why you have to manage and unfortunately masih kekal lah peptic ulcer disease sampai ke tahun 2023 ni because of the NSAID related peptic ulcer disease lah. Okay, reduce prostaglandin production, it causes the harm to the protective mechanisms in your stomach, and then the patient is more likely to get peptic ulcer disease and apa GI bleeding as well as perforation, as well as perforation. Okay, so tadi H. pylori is a success story. Success story. Kita boleh eradicate sekarang ni. Siapa patient you discover, oh patient ada ulcer, kita test, oh ada H. pylori, kita treat, success. Tapi NSAIDs belum sukses, belum sukses. Until now, is a lot of work is still being done to try to look for alternative antiplatelet agents that do not cause or reduce the risk of getting peptic ulcer. So banyak agent sekarang ni which are trying to target specific pathway which is not having the same effect as aspirin lah. Okay, so kita nampak lah. So kita nampak this is the prevalence, the global burden, global burden of peptic ulcer disease. Kita tengok prevalence from 1990 to 2019 menurun, tapi sampai lebih kurang tahun 2005, 2006 macam tu dia stagnan, tak turun pun dah. Dia tak turun lagi dah. Dia kekal. Memang ada around 100 people per 100,000. Maknanya about 1 dalam 1000, setiap penduduk dalam dunia 1 dalam 1000 akan ada peptic ulcer. 100 per 100,000 akan ada peptic ulcer. So you akan jumpanya patient ada peptic ulcer ni dalam you punya practice nanti. You akan confirm akan jumpa or at risk of developing peptic ulcer because they will be either having H. pylori which you can easily treat, but they will be also, if they're taking NSAIDs, yang tu susah sikit. You have to manage that risk lah. Because kalau you stop NSAIDs, what do they get? What is the problem? Kalau if you stop NSAIDs,
Thromboembolism.
you don't prevent their risk of getting heart attack and stroke. So you kena bagi juga. Tapi at the same time dia ada risk of having peptic ulcer disease. So you kena balance between these two. You can look at alternative agents lah. Okay? Nampak tak? Senang ke jadi doktor? Jadi doktor bukan cat hitam putih. Jadi doktor memang you need to be berfikir dengan mendalam dan menyeluruh, because you need to make very important clinical decisions for the best of your patient. Dia bukan hitam putih je. Sakit apa nak makan ni? Bukan macam tu. You kena fikir all this risk and benefit for your patient. So you can see the mortality. This is mortality. Kenapa tak cantik dia punya? Kenapa ada tak boleh naik sikit? Dah rosak ke ni? Rosak. Dia punya motor rosak kat atas. Anyway, okay, tak apa. Tak apalah. Korang tengok je trend tu. Trend ni, this is mortality. Mortality caused by peptic ulcer disease since 1990 menurun. Tapi lepas tu tak turun lagi. Plateau, tak turun lagi. Masih memang sampai tahun ni pun masih ada mortality caused by peptic ulcer disease. Although alhamdulillah it's quite low lah. It's about 2 to 4. Yang merah ni perempuan, yang biru ni lelaki. So you can see that is still around 2 to 4 death caused by peptic ulcer disease per 100,000 people. Maknanya kalau dalam Malaysia ni berapa 100,000 kita ada. Maknanya memang ada mortality by peptic ulcer disease. Okay, so dia menurun because of success with the treatment of Helicobacter pylori, tapi mendata sebab kita ramai population kita dekat luar sana ada ambil NSAIDs, mainly for antiplatelet, but also some of our population dia ada chronic pain. Orang yang ada chronic pain dia makan NSAID juga every day to treat their pain. So these are the risk population lah. They might be getting peptic ulcer disease. Also patients who are taking steroids, ada juga patient yang makan steroid every day for inflammatory conditions. Patient SLE for example, dia makan steroid every day. Patient with severe asthma, steroid every day. So if they take steroids every day, also at risk of peptic ulcer disease. Okay, so sentiasa akan ada. And then ada lagi masalah lagi satu. Baru. COVID-19. COVID-19 dah melanda since 2020 until 2000 last year 2022. Basically everybody has kena COVID. Ada ke dalam kelas ni yang tak pernah positif COVID? Ada juga tak pernah positif COVID. Okay. Tapi mungkin dah kena cuma asymptomatic kot. Tak pernah. Okay, good. That means itulah alhamdulillah some who are asymptomatic or never tested positive for COVID. Actually you all should be studied because you have a very good immune response. Maknanya your immune system memang very good. You can easily brush off the COVID infection. Of course together with the vaccination lah kan. But even macam saya pun dah kena triple vaccination hari tu pun. Lepas tu balik daripada umrah positif juga COVID kan. Tapi I have only had very mild symptoms. Okay, so even maknanya immune system saya tak sebaik Allah tak sebaik. Memang pun kan saya ni banyak sakit. Semua sistem saya ada sakit. Semua kardiovaskular ada, respiratory ada, ENT ada, GI ada, GU tak ada lagi. GU tak ada lagi. So semua sistem saya ada sakit. So memang sesuai lah jadi pensyarah perubatan, boleh bersyarah tentang penyakit sendiri dan about the topic lah. But of course it's a problem because COVID-19 there are a lot of emerging research showing COVID-19 has long-term and significant effects on the GI tract. And the most common reported symptom by patients who have had COVID-19 in the GI system is related to peptic ulcer disease. Most common is nampak ni, dia ada dyspepsia, gastroesophageal reflux and peptic ulcer disease. So I predict COVID-19 will lead to a higher prevalence and higher morbidity related to peptic ulcer disease because somehow COVID-2 memang ada effect, pro-inflammatory effect I guess on the GI tract mucosa. Okay, so you all nanti when you very soon you all ni bakal doktor ni dalam masa beberapa tahun jagung je lagi you all akan berada di hospital. So by that time you have to be very vigilant and manage your patients kalau dia ada peptic ulcer disease So you have to tanya patient terus kalau dia ada GI atau GI ada abdominal pain dan sebagainya, you have to manage aggressively lah for peptic ulcer. Okay, so how do you manage? Let's look at the drugs now. Okay, let's look at the drugs. Drugs for peptic ulcer disease, alhamdulillah they are simple. Drugs for peptic ulcer disease, I know you just finished anti-cancer drugs. I know you all were struggling kan. Anti-cancer drugs memang payah. Saya pun susah nak handle. Nasib baik saya tak payah mengajar. Anti-cancer drugs. Because I know how tough it is. There's so many different classifications. They all have very complicated mechanisms of action. Betul tak? Nama pun pening dengan cyclical apa bagai semua kan. Antifolate, lepas tu ada apa yang nama paling panjang sekali sampai ada 5 nama dia. Anti-neoplastic, anti apa kan. Pada MPO lah, tak apalah, pandai-pandai lah belajar So you all have to manage them carefully, okay. Macam saya cakap lah, baca, fahamkan the classification dulu, the categories dulu. Jangan menghafal. Fahamkan the categorization, the classification. Look carefully at how they act, the mechanism. Lepas tu baru dah akan turun dalam kepala otak you about their names kan. Tapi yang penting kena faham konsep dia dulu. How do they act? How do they work? Okay. But fortunately for peptic ulcer disease is much more simple. Much more simple. Because essentially there are 3 big categories. Firstly, you reduce acid secretion. These are actually the best the best agents, acid secretion inhibitor, you go a long way to prevent fatty ulcer disease. Sebab acid is the primary aggressive or corrosive factor on the gastric mucosa. You jaga acid, mucosa tu akan lega dia tenang, sejahtera, kurang asid ya. You can also use neutralizing agents, which are antacids. These are very simple agents that again neutralize excessive acid, excessive corrosive factor. You also have agents that protect the gastric mucosa, what we call the cytoprotective agents. Okay, so and this is the main or the biggest category that protects the gastric ulcer, which is an agent that reduces acid secretion. And this, when they were discovered, these PPIs or proton pump inhibitors were so effective and they were so widely used that they became blockbuster drugs. Blockbuster ya. Pernah dengar tak blockbuster? Saya pernah cakap kan blockbuster. Drugs that sell over $1 billion per year. So these are blockbuster drugs. So apa yang saya contohkan dulu as a blockbuster drug dulu?
Lipitor.
Statin kan, dulu statin is a blockbuster drug. Sebab bila dijumpai, bila diluluskan, memang sangat-sangat efektif digunakan secara meluas. Similarly, proton pump inhibitor for fatty ulcer disease, very effective. So when they were launched, when they were approved by the FDA, EMEA, they were then sold in massive numbers to the population because they were very effective in reducing the risk of fatty ulcer, because they are very effective to reduce the secretion of acid. What is their mechanism of action? Look at the name. Proton pump inhibitor. They inhibit the proton pump. What is the proton pump? The proton pump is a sodium bukan sodium.
Potassium.
It's a proton pump. Proton pump apa dia? A proton is a hydrogen plus ion. Hydrogen potassium ATPase pump. That's a proton pump. Dia exchange, dia keluarkan daripada gastric parietal cell hydrogen, dia ambil balik in exchange a potassium. Hydrogen ni yang akan jadi acid. Dia akan jadi nanti acid dalam stomach, hydrochloric acid. So if proton pump inhibitor boleh block this pump, acid akan jauh menurun dalam gastric contents. Sebab pump ni dah kena block. The proton pump that eventually pumps out proton that eventually becomes the stomach acid is now inhibited by the PPI, and therefore the stomach is unable to produce large amounts of acid. Jadi acid terus berkurang. Acid berkurang je, gastric mucosa menarik nafas, lega kan, kurang dah serangan acid. So kurang dihakis, lebih sejahtera, taklah jadi ulcer. Okay, and it's very effective, up to 90% inhibition after just one dose of gastric acid production. And what are the examples of this? These are the examples. Dia ada prazol kat belakang. Omeprazole, pantoprazole, lansoprazole, esomeprazole and rabiprazole. Kalau nama trade name dia dulu Losec, Omesec, adalah nama-nama trade name banyak lah. Tapi the agents are omeprazole, pantoprazole. These are excellent proton pump inhibitors. Okay, nanti you baca lah about dia pharmacokinetics. Okay, but these are the very effective acid secretion inhibitors. Okay, there's some adverse effects, but relatively mild. Nanti baca sendiri. Okay. And then we look at another category of agents which are neutralizers. Yang ni lebih lama ya. sebelum dijumpai PPI, kita just pakai antacids, but they were not very effective because they directly agents that neutralize gastric acid. Ini yang you selalu dapat ni kalau you pergi jumpa doktor klinik akan bagi ni dulu kat you. Sebab you all are young and likely to develop peptic ulcer. Tapi you all kan selalunya sebab stres belajar atau stres stres dengan kawan atau stres dengan lecture kan, stres dengan Dr. Naim tu, stres atau muka Dr. Naim tu macam tu kan, sampai sakit perut, stres kan. Okay. Pergi kat klinik jumpa saya kan tak ada. Pergi ke klinik jumpa doktor lain. So doktor akan bagi, okay, rasanya awak ni gastrik, banyak sangat asid dalam perut ni. Ada stres ke? Ada stres. Kenapa stres? Saya stres dengan cara saya. Okay, tak apalah. Saya tahu kan, saya awak. Nah, awak makan antacid ni. So the antacids examples are MMT. What do MMT? MMT is magnesium trisilicate or aluminium hydroxide, sodium bicarb pun boleh, calcium carbonate, banyak antacid ni banyak. Jadi they are usually jenis yang macam ni lah. They are salts that can neutralize acid. So dia masuk dalam you makan, you telan, selalunya di dalam yang putih-putih tu, cecair putih-putih tu kan. Some of you pun dah dapat, atau di dalam tablet yang you punya you telan, dia akan kurangkan because they neutralize gastric acid. But they are not that effective at preventing peptic ulcer. Sebab acid masih keluar, you masih stress kan. Lepas tu you masih stress. Kalau you tak solve your stress kan, you jumpa lagi pencara yang menyebabkan you stress, datang balik stress because your stomach is still producing gastric ulcer. Okay, so they are not very effective compared to apa tadi? Apa yang lebih efektif?
Proton pump inhibitor.
Okay. Apa yang nanti you baca sendiri the adverse effects. Okay, and this is another example of older. Ni before. These are some older agents that we were using before we were able to use PPIs. We use this histamine H2 antagonist. Histamine receptor 2 antagonist. How do they act? This acts on the H2 receptor in the stomach. There is a H2 receptor which mediates the release of the certain agents. For example, histamine, gastrin, and these agents are then mediating the release of gastric acid. So kalau kita block the H2 histamine receptor, dia akan block the release of agents that mediate acid release. Okay, but still because dia berlapis-lapis, they were not that effective. Boleh lah when we use agents like cimetidine, ranitidine, famotidine, they were somewhat effective to prevent the release of acid, but not so great, not so much. Masih problem lagi, banyak lagi acid. Until we discovered the proton pump inhibitors, baru lebih efektif. Yeah? So this is another category of acid reducers or acid secretion inhibitors, what we call this histamine H2 receptor antagonists. Okay. And we can then combine. Mana-mana ni tak baik tengoklah combine tadi. Okay, kita dah cover the acid inhibitors. Let's look at the protective agents that we use. Yang ni not that common sebab kita dah tak bayar dah. With the PPI, bayangkan PPI ni so effective, kita guna bila PPI ada, kita dah tak bayar fikir dah drug lain for a long time. Unless kalau teruk sangat, baru kita fikir these drugs lah, these cytoprotective agents. So an example is bismuth chelate. It's an example of cytoprotective agent. What does it do? It actually is a chelator, so it binds to the gastric mucosa, and then it precipitates. Jadi dia macam jadi satu layer to protect the gastric mucosa, so that pepsin or hydrochloric acid dia tak boleh nak hakis sangat the gastric mucosa, ya. So it's a protective agents at the ulcer, at the base of the ulcer, or and at the gastric mucosa generally, ya. It also helps to increase protective factors such as prostaglandins and bicarbonate secretion. Okay. Dia also ada some other effects where it also Bismuth kilat ni bila dia bind to the gastric mucosa, dia also dia lawan kepada Helicobacter pylori. So it also has some effect to prevent or to reduce the pathological mechanism caused by Helicobacter pylori. Okay. Then kita ada another agent, what we call sucralfate. Sucralfate is actually a carbohydrate. It's actually a sugar. Then the sugar is we complex with this aluminium hydroxide. We complex with aluminium salt, aluminium hydroxide, complex with the sugar. Kita jadikan nama dia sucralfate. So dia pun membantu defense, mucosal defense, because as a complex, dia juga melekat dekat gastric mucosa. Dia prevent the attack by pepsin, bile and other corrosive agents on the gastric mucosa, and it also increases and stimulates protective factors of the bicarbonate and the prostaglandins. Okay, sucralfate, and we also have another agent which is a direct prostaglandin promoter or prostaglandin analog, what we call misoprostol. Misoprostol is an agent that is an analog for prostaglandin E1, and it is useful to use in the GI tract for patients with risk of stomach ulcer, because dibanyakkan prostaglandin. Bila banyak prostaglandin, it helps to protect the gastric mucosa and promotes ulcer healing, and it prevents the damage caused by especially NSAIDs lah. So NSAID depletes. Makan banyak aspirin, it depletes all the prostaglandin. So kita tambah with misoprostol. Okay. It inhibits acid secretion. Okay, some little bit, but it's more protective by the prostaglandin effect. Okay. Interestingly, misoprostol is also used to terminate pregnancy. Nanti you akan belajar nanti later on when you learn about it. But because it's a prostaglandin analog, bila patient bukan patient perempuan in early pregnancy, kan, kalau you bagi misoprostol, dia akan ripen and open up the cervix dan eject the kandungan rahim lah, the uterus contents. So it's actually an effective drug to use to terminate pregnancy. Tapi dia dah diharamkan sebab banyak disalahgunakan di Malaysia pun disalahgunakan banyak di Malaysia to use to terminate early pregnancy. Yang young women who have became pregnant, jadi dia nak gugurkan kandungan rahim, dia pergi certain clinics dulu kat Malaysia dulu ada, jadi doktor bagi ubat misoprostol, gugurkan kandungan rahim lah. Tapi then it has problem sebab sometimes these women they are not monitored medically, they then bleed continuously and ada yang meninggal. The young women, dia mengandung tapi dia tak nak mengandung, dia pergi jumpa doktor klinik bagi misoprostol, lepas tu dia balik rumah makan misoprostol, kandungan dia turun tapi dia bleeding, dia bleed non-stop, and then dia pass away sebab of the massive bleeding. So because ada kes-kes macam ni, terus lepas tu diharamkan lah. Memang praktis tu pun tak beretika ya. Praktis tu sendiri nanti akan belajar. Ni akan belajar lebih lanjut bila you belajar year 6 nanti you akan buat untuk ethics. Okay, so termination pregnancy very sensitive. Dan daripada segi Islam, very clear ada banyak panduan untuk tak boleh, memang tak boleh kan, kecuali pada kandungan tu mengancam nyawa ibunya baru boleh. Dia ada hukum-hukum syarat yang you kena kaji lah sebelum you boleh membuat early pregnancy termination or termination of pregnancy. Okay, tak boleh sewenang-wenangnya. Okay, so nampak tak menarik? There's the interplay kan, nampak tak? Although digunakan untuk GI tract, tapi drug ni is also used for another purpose. Tapi masih ada misoprostol ni, masih ada apa ni, jabatan jabatan apa ni, ONG lah, Obstetrics and Gynecology. In certain conditions, kalau kandungan tu mengancam nyawa mak dia atau kandungan tu memang kita tengok is not viable, doktor can use misoprostol to apa ni, to terminate the pregnancy. Okay, so those are the drugs that are used. So you have drugs to prevent acid secretion. Basically, the best is PPI, but also histamine 2 antagonist. But also you have antacids, and you also have drugs that are protective of the gastric mucosa. Bismethylate, you have sucralfate, and you have misoprostol. But as I was saying before, if you ever find that your patient has positive for Helicobacter pylori, and it's very easy to test. Siapa pernah tahu macam mana nak test for Helicobacter pylori? Nanti akan buat masa mikro. Tapi siapa mungkin pernah terbaca? How do you test for Helicobacter pylori?
Oh, yang tu.
Breath test.
Breath
You can
test.
do a urease breath test. Very simple. Tiup je. Tiup je dalam tabung tu. Nanti dia akan tengok, akan ada result sama ada your stomach contains Helicobacter pylori. Kalau positif, senang je, terus rawat. And how do you treat Helicobacter pylori? You use eradication. You use eradication, and usually the eradication is using several drugs. Dia tak boleh satu, tak cukup. It's a very hard hardy bacteria. Dia tough. Dah boleh duduk dalam stomach, memang tough lah. So kita need to use multiple, kita panggil nama dia sebenarnya adalah triple therapy. TT, teh tarik, bukan teh tarik, teh tarik bukan ubat. Teh tarik bukan ubat ya. Teh tarik bukan penawar. Penawarnya adalah
Triple therapy.
triple therapy. Teh tarik tu adalah penyebab putus kaki. Manis sangat sampai boleh putus kaki kan? Manis sangat sampai boleh putus kaki. Itu lawak orang kampung lah. Lawak orang kampung. Sebab dia ramai yang diabetes, lepas tu dia kena diabetic ulcer, food ulcer, lepas tu kena potong kaki. Sebab tu sangat dia tak terjaga dia punya diabetes. Okey. Tapi untuk peptic ulcer kita bagi triple therapy. Triple therapy which usually consists of, triple must be berapa? 3. Triple must be 3. One is a PPI, and we use 2 antibiotics. 2 antibiotics to treat the Helicobacter pylori. So you use usually one PPI, omeprazole, pantoprazole, lansoprazole, and then we use 2 antibiotics. Usually the antibiotics are clarithromycin, flagyl, or metronidazole is flagyl, metronidazole, and amoxicillin. These 3 common use lah. Clarithromycin. Clarithromycin is a macrolide. Kita dah buat antibiotik belum buat kan? Nanti saya yang ajar kot, antibiotik saya ajar. Clarithromycin is a macrolide. Metronidazole or flagyl is specific for lower GI tract antibiotic, very good, and amoxicillin is a penicillin. Apa nanti kita akan tengok antibiotik ni pun banyak, kita akan tengok nanti. Okay, so ni dia common triple therapy, omeprazole plus clarithromycin plus amoxicillin, omeprazole plus clarithromycin plus metronidazole. Sometimes kita boleh tambah bismuth. Remember I was saying before, bismethylate dia boleh duduk dekat gastric mucosa, dia boleh precipitate, and dia boleh interrupt Helicobacter pylori. Ini contoh-contoh dia lah, banyak contoh. Tricotherapy ada, even ada quadruple therapy. Kalau liat sangat Helicobacter pylori tu liat sangat, kita boleh bantai empat bantai dia dengan empat terapi ya, empat terapi, quadruple therapy. Okay, bismuth kita bantai dengan metronidazole, tetracycline plus a PPI plus a proton pump inhibitor. Okay, so I think that this one is some extra information you can look up afterwards. Okay, look up afterwards. Okay, yang Helicobacter pylori tak apa, kita dah berjaya kiranya. Kita boleh easily eradicate with triple or quadruple therapy to eradicate Helicobacter pylori. Tapi like I was saying before, NSAID ni susah. Mungkin kita boleh fikir ni yang macam kenyataan pertama ni. Kenyataan yang mudah tapi susah dilaksanakan. Cakap senang, susah bikin. Cakap senang, susah bikin. Cakap senang, discontinue the use of NSAID. Tapi jangan, susah. Because we cannot easily discontinue. We have to manage the patient's cardiovascular risk. So, kita kena switch to a different type of NSAID. Okay, different type of NSAID. Dulu ada coxib ni. Coxib ni ada COX-2 inhibitors. Korang dah buat kan COX-2 inhibitors? Kan, dia pun mula-mula bila keluar dia pun blockbuster juga. Vioxx semua tu kan. Wow, these are amazing drugs. NSAID, but they do not lead to peptic ulcer disease. They do not lead to GI bleed. Tapi kemudian barulah nampak pula masalah dengan coxib ni. Siapa makan coxib, dia lagi tinggi risk of death. Tengok tak tu? The story with the early coxib. Mula coxib tu was discovered is a fantastic discovery. Tapi lepas tu bila dia tengok after given to the population, after a few years tengok it actually leads to a higher risk of death due to cardiovascular myocardial infarction and stroke. Terus ditarik balik pula. Lepas tu terus semua coxib, semua COX-2 inhibitors dia ada black box warning. Tahu tak black box warning? Black box warning tu setiap doktor dia dah berjaga-jaga, dia takut-takut nak bagi. Sebab they have a very bad safety profile. Maknanya although they inhibit COX-2 saja, they reduce incidence of peptic ulcer, reduce incidence of GI bleed. Tapi masalahnya they have a high, somehow they increase the risk of getting padahal dia untuk mencegah, tapi dia pula menaikkan pula the risk of getting a thromboembolic event. So very interesting story. So macam itulah. Sebab tu kalau kerja farmako ni boleh, insya-Allah kerja tu selamatlah. Memang tak habis-habis masalah dengan drugs ni. Tapi nak makan tak boleh, nak elak tak boleh, nak tak nak patient kena makan juga. Tapi dia ada macam-macam masalah dengan drugs ni. So you kena kaji kan. Okay? So mainly nampak you cannot discontinue NSAIDs. You have to then manage as best as you can by using PPIs or any other methodology of preventing the cardiovascular risk. Okay, nampak? Some you can give misoprostol, you can give prostaglandin. Maknanya NSAID deplete prostaglandin, you top up, you supplement with misoprostol. Or then you give all together with PPI, reduce the acid secretion. Okay, dan sebagainya. Ini a little bit about GERD reflux. Reflux is even more common daripada ulcer. Gastroesophageal reflux disease is where gastric contents naik balik to the esophagus. Kita panggil heartburn atau pedih ulu hati, atau apa yang kita panggil lagi yang bila gastric content naik ke esophagus, pedih ulu hati, heartburn dan sebagainya. Very common. Dalam bilik ni ramai yang ada, kan? Adalah, mungkin belum lagi, nanti ramai yang ada nanti, mungkin muda sangat nanti, kan? Tapi mungkin ramai nanti ada. Saya pun ada, kan? Saya memang ada juga reflux, ya. Nampak? Dia ada reflux of the stomach content into the esophagus. Ni pun gambar, sepatutnya macam ni. Tapi due to a lot of factors, stress, over acidity, kita punya habits, lifestyle habits, memang ada reflux. Okay. But treatment is actually quite good. We can give the effective treatment is actually alginate. Alginate or Gaviscon. Nama trade name dia Gaviscon. Alginate is probably the best treatment for reflux. It forms a barrier that prevents reflux. Jadi selesai dah masalah. So that's the simple alginate. Atau the trade name is Gaviscon. Habis. So wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. So that was the topic on Peptic ulcer.